Hi, my name is Paul Nestadt. I'm an associate professor of psychiatry at the Johns Hopkins School of Medicine, and I'm the medical director of the Center for Suicide Prevention. Over 4,000 Americans attempt suicide every day. Fortunately, most of them survive. However, if a gun is available and used, the chance of survival becomes very slim. In 2023 alone, over 27,300 people died by firearm suicide, an all-time high. Firearms are the most lethal form of suicide, and we as clinicians have a responsibility to help mitigate this public health crisis. Here are a few ways that we can help lower that number and save lives. First, lethal means safety assessment and counseling. This program helps clinicians work collaboratively with their patients to reduce the risk of injury and death by firearms. Studies have shown that patients want their healthcare clinicians to ask about guns and offer guidance. Next, extreme risk protection orders, or more commonly known as red flag laws. These are civil court orders that temporarily restrict firearm access for people who present a high risk of self-harm or harm to others when armed. Guns are the most common lethal method of suicide in the United States. Limiting access during times of crisis can save a life. And finally, safe, secure gun storage. When not in use, firearms should be stored locked and unloaded using methods like a cable lock or a lockbox. Clinicians can help inform patients' gun storage practices, which in turn can substantially lower the risk of suicide or other firearm-related injury or death. Firearm suicide in the United States is a public health emergency, and we as clinicians need to make sure that we're there for our patients. Learn more on our website and see how you too can help to save lives.